Okay, this story deals with someone else who was very dear to me, a 66-year-old man who developed a medical emergency. Our health plan is wonderful and has urgent care over the weekend. And in fact, the people who saw him, he really developed, how do you say, perianal abscesses, which are more common than people would realize. He thought it was just hemorrhoids. Anyway, they had the good sense, the healthcare providers on the weekend had a good sense to know what was beyond their abilities and sent him over to the emergency room at the hospital, which is a fine hospital, no complaints in general. But the problem developed because here's someone who's in severe pain, and the people, I forget exactly, the triage are asking him for his medical history. Now he's, can't sit down, he's in severe pain, he's keeled over, and they're asking him to give a list of his meds. And he couldn't even think, whatever, and yet the medical history and the whatever was easily accessible if had they been able to just lift up the phone or speak across the street. Somebody could have faxed it over, but they didn't bother. So that the point here is the lack of a centralized access to medical history created complications after his surgery that created pain and difficulty and greater harm and a recurrence of disease because of the lack of history. They left out meds that needed to be administered to him, ignored them, and then also did not look at the underlying causes of the problem, just treated surgically, but didn't afterwards run careful lab studies to treat the infection so that he developed it several more times. Now, this could all have been avoided with a preventive approach that looked at the whole body, all the problems, rather than treating the symptoms. So my point is, again, to advocate with all my heart power for centralized medical histories that give doctors, patients, all of us the ability to save money, preserve good health, and prevent accidents, even deaths, all with the simple approach to being able to know your patient fully and completely. And thank you very much.